There's a number of substantial differences between radiotherapy and chemotherapy. I guess the most obvious one is that chemotherapy is a drug which is usually given into a vein or swallowed, whereas radiation therapy is beamed into a patient, for want of a better phrase. In terms of the way that they work, there's a number of similarities in that radiation therapy damages the DNA of the cancer cell, which is why they want to direct it directly onto the cancer. And what it does is it damages that DNA so that the cancer will then die. Many chemotherapy drugs also act by damaging the DNA of the cancer. One of the differences, though, is that radiation is targeted directly onto the tumour, whereas because chemotherapy is introduced into the whole body, it can affect many different parts of the body as well. Having said that, there are some tumours which are either not sensitive to radiation, so chemotherapy is the only option there, and there are some tumours which are much better treated with chemotherapy as well. The other thing to say is that they have a different spectrum of side effects, and diseases like leukemia, for instance, are often best treated with chemotherapy, and radiation therapy has a more limited role, whereas some of the other tumours, radiotherapy has a very important role. And again, over many years, we've worked out which modality is most appropriate for which tumour.